Are you tired of quick fixes that promise transformation but leave you feeling more disconnected from your body than ever? Welcome to the Beyond Medicine Humanized Care for Women of Influence podcast, where we go deeper than surface level solutions. I am Dr. Maria, a functional integrative physician specializing in women's health, hormone balance, metabolic dysfunction. Here, we will uncover the root causes of insulin resistance, PCOS, thyroid, and adrenal issues, and explore how trauma, stress, and anxiety impact your well being. Because your body is not a microwave, it deserves personalized, compassionate care that honors its complexity. Let's embark on a journey to reclaim your health one conversation at a time. And today I have in the program with me Dr. Gabriela. She is an integrative medicine physician in Austin, and she is the owner, and you can find her at Resilient Health. And today we're going to be talking about genetic testing and personalized medicine. So welcome to the podcast, Dr. Gabriela. Do you want to start by just quickly introducing yourself, telling us a little bit about who you are and what you do?
Sure. Thank you so much for having me in your podcast, Dr. Maria. Very excited to kind of talk to the world or whoever's obviously of the importance of medical genomics and how we can target it for more personalized attention and to better understand how our body works. I've been in the integrative and functional medicine world for about 5 years or so. I actually had several years, over 10 years of practicing primary care between first in Louisiana, and then I have moved with my family to Texas. But I didn't actually started diving into this type of medicine pretty much until 6-7 years back when I decided to do my integrative medicine fellowship and kind of open a whole new world. I was pretty much like most of us in practicing primary care, trying to find solutions for our patients, especially the people that are much more chronically sick. I was just getting so tired of just doing prescribing a pill and not really diving into the root cause of what's actually driving many of these metabolic processes and chronic illness for our patients. So such as your experience with handling people with, let's say, with metabolic disorders, or especially like with type 2 diabetes and in general, we kind of like, and you've seen this, how much we can do for our patients in terms of addressing their lifestyle, addressing their environment, how much we can influence and how they get better from these chronic issues, chronic illnesses. So that's why I decided to kind of practice different way. I got a bit burnout in the corporate healthcare field. It was great for gaining experience, but it actually helped me kind of know exactly how I wanted to practice medicine. So now I have this concierge medicine practice here in Austin. We've been very successful trying to bring more personalized care to our patients in longer appointments. And one of the many tools that I use is the medical genomics and certain tests to kind of address much more in depth my patients.
Yeah. So thank you for sharing that. And one of the things that I just want to mention is that Dr. Gabriela and I, not in the same years, but we both completed our fellowship with the Academy of Integrative Health and Medicine out of California.
Right.
So I am not only talking with a Latina like myself, but then I'm also very happy that I'm talking with somebody that I know the training and the evidence that is behind what we're doing and how effective it can actually be for patients that perhaps, as you said, in the traditional way of taking care of their health and system, it's just things are not improving and getting better.
Right.
Yeah. So let's dive in a little bit into the topic for today.
Yeah.
So in like simple words, how would you explain to people that perhaps do not know what personalized medicine is, that maybe when they think about genetic testing, they think of the common things like, oh, maybe let me see if I have a predisposition like to breast cancer and the BRCA genes. So when we talk about personalized medicine and genomics, can you explain in simple words like what we're talking about and maybe why is it that this is important to look at?
Right. So, with the use of the medical genomics, this is why nowadays we call it personalized medicine. It's pretty much studying the certain genetic variants. We call these SNPs. SNP stands for single nucleotide polymorphism. It's kind of easier when we call it SNP. And it's kind of the way that I like to explain to my patients is just kind of like small change that occurs within a gene. Some of these can be clinically significant, oftentimes may not. And kind of to give you an example, it can kind of let us know if, let's say, a certain protein or an enzyme may work effectively or not. So, for example, when the famous one called MTHFR, which is related to our methylation, this one was the one very first ones that was, pretty much publicly even advertised. We would hear it all the time, even nowadays still prevalent. But this one is pretty much related to the way that our participates in the process of methylation in our genes. So oftentimes that could mean providing certain methyl donors or group to the DNA to pretty much turn on or turn off a gene. And oftentimes when we actually, let's say I do see somebody that does either has two copies for this particular genetic variant for the MTHFR, I want to actually address with my patients the folate. Are you getting the methylated folate? Because what we've known is that these patients effectively, they cannot get the folic acid from their diet. So oftentimes we have to give it from external sources. Now, I have some patients that their diet is excellent with eating their green leafy vegetables. But then I may have somebody that might be struggling with, let's say, a mental health issue, such as depression, anxiety. And then I see that, for example, they have an okay diet, but we want to really help them out more. I often would consider doing something like a methylated B vitamins and address it also with their diet. So there are tons of examples out there of these particular genetic variants, but usually most commonly people have known is what you said earlier about, the BRCA gene, just kind of like knowing the genes that would make you, let's say, at risk for a cancer in that sense. But this is more of how our body functions. Are you going to be the type of person that might need to get actually B12 sources? Or it would be enough for you to get it within the diet? These are pretty much things that you would be considered to be at risk. But again, you mentioned earlier the word epigenetics. We do know that there are certain factors, environmental factors, either with our lifestyle, nutrition, or exposure. This is where epigenetics comes to play because it can actually help either some of these genes to kind of turn on, or it can actually affect it in a, let's say, negative way. Somebody that may have a poor, let's say, detox type of SNPs, and they're exposed to, let's say, smoke toxins, they're a smoker, we know that this person may be more at risk for developing or at risk for getting something like cancer.
Mm-hmm.
Yeah.
Yeah. So thank you for explaining that. So basically, right, when we're talking about genomics and that testing, really what we're looking at is, so we're all different in terms of our metabolism. And a lot of the times people think that metabolism is related to like how fast you burn calories and your weight. But when we're talking about it, it's really how at the cellular level, all of like the signals and what your cells need to do, like they're like little machines, like it's almost like how these machines are working, and that can be different. And correct me if I'm wrong, one of the reasons that this is important is because you mentioned the vitamin Bs, right, and like folate. So not everybody, so there's also people that if you give them too much of these methylated vitamins, it can also cause changes in how they feel, how they function. And one of the areas where I think that this is very useful, and please let me know if you find that is also very useful in some other areas, is when it comes to like mental health, right? I think that for these patients, it has a really positive impact. So tell me a little bit more about if you are going to use specifically genomic testing, and then we'll talk about epigenetics. What is the type of patient that you think that maybe can benefit from this testing as a way to look a little bit more into what else could be going on in their body, that it's not their fault because these genetic variants are not their faults, but that we can do something to help them.
Yeah, so I have to say that I have had a wide variety of patients that have come to us either because they want to do it for prevention. They may have had like family that has like, oh, my father was recently diagnosed with Alzheimer. I want to be on top of my health and see what else I can do to prevent it. I've seen also some patients that they are adopted, so they're not fully aware of their risk factors for certain diseases such as cardiovascular disease or diabetes even. And then you do have the certain population that they have gone to so many different doctors. They are trying to pretty much nothing else has worked. So they're trying to find a much more targeted way using personalized medicine like the medical genomics to help them out more. I do have to say I have some patients that they have come to me that with a very long list of supplements, and that's not what we want. This is not what I do. There's some misconception out there that when you go to an integrated functional doctor, they're going to put you in tons of supplements. It's not like that. But usually with the medical genomics, I have been able even to some of these patients kind of like tell them like, really, you don't need this. You should actually focus with this, and then you should change your diet. And, we talk about many, many things. So it's not just a way to kind of give you a recommendation of like B vitamins. We're trying to figure out also talking in depth about what is their lifestyle. Like, hey, you do have here in your medical genomics that you have 2 copies for the ApoE4. This is highly concerning because we know that this one is linked with a chance increased risk for like Alzheimer. So I do want to address things like the evidence that is out there on doing the keto flex diet, which has been proposed by Dr. Bredesen. We did our practice is also trained on the RECODE program, which is the one designed by Dr. Bredesen for doctors, where we address different fields from diet, nutrition, lifestyle, certain use even in alternative medicine, other than even also what is currently mainstream now in, even in conventional allopathic medicine. So that's how I like to combine all of these tools. It's just something added other than knowing, let's say, doing the lab test that I need to know for my patients, right, and do for my patients. But I also want to get that other piece of the puzzle. What are you might be at risk for? And again, your genes it's not your destiny. You have ways to actually address them. And by just being more conscious and more aware of, let's say, what kind of lifestyle changes you need to make. So that's how I kind of like to present it to most of my patients or people that kind of ask me about this. And pretty much is telling them it's a blueprint. It's just another way how best you can handle things if something would come up as well for you in later on as you get older.
Yes. And I think that one of the reasons also that I personally like it is, and that's why we call it personalized medicine. There are some, so there are some like common things that we know when it comes to lifestyle, right? Being physically active is better than being sedentary. Sleeping is better than being sleep deprived. Like these things that is more like common sense. But then I think that this also helps know a little bit more like those differences that
Right.
sometimes in mainstream, in terms of like, oh, this is what you need to do in the mainstream wellness, social media kind of like environment. And it's that maybe that's not what is going to be completely beneficial for your body to optimize it and to reduce your risk of certain illnesses and prevent it. So I think that that's also one of the reasons that is good, because sometimes also patients are doing things that they think that is completely beneficial for them.
Right.
And
Mhm.
it is not that it necessarily is wrong. It's just that for them, maybe what we need to do is differently.
You're right, right, right. Yeah, I have like, you won't believe that how many, people have come through my door and saying like, yeah, I'm trying this or I'm taking this, but they don't really know. First, they don't know if they truly need it. And yes, that's why it's great that we have access to tons of information, but sometimes certain information we have to be careful. And that's why patients come to me we kind of make an informed decision like, well, you may consider this, or hey, if you really want to know further what your body truly needs, then let's consider something to do like a medical genomics testing, which is
Yeah.
very helpful. Most of my patients that I actually ended up doing, they find a high value to it. But again, you do also have to be prepared for making the changes that you need to make.
Yes. 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 I think that with everything that we do in medicine is, okay, we're going to do this. Are we ready for like the intervention, or can we
Mhm.
help you? Right. Because otherwise, I don't know, maybe not for every patient, but otherwise for some patients, maybe knowing that they are at risk of certain illnesses might give them anxiety then and the mind starts to like race. And I think that that's very dependent on, the patient that it is and what's going on in their lives. But that's something,
Yeah.
to always keep in the back of, I think us as clinicians, that we need to keep in the back of our minds. So
Yeah, I definitely consider that because I've had people that are like, I really get anxious. I really don't want to know. But then I
yeah,
kind of talk them through and then they kind of rethink about things and then they decide to do so. Or I've had people that they really want to know every single detail. So yeah, I see, different sides of the spectrum on those.
yeah, yes. Another, so when we hear some of these like buzzwords, right? So genomics, nutrigenomics, epigenetics, are they all the same thing, right? So when somebody comes for testing, are they all the same test, or is there something that is a little bit different in each one of these, like testing or type of analysis or labs that we are doing, that maybe somebody can consider one versus the other, depending on the information that they are seeking?
Well, yeah, they're kind of intertwined, but they're different. And now this field is actually exploded. Now we have tons of even direct to consumers type of tests that people with the click of a button, they can actually order it and you get the kit. Either you do either a salivary swab or a finger stick prick. So it makes it kind of easier, but not all labs out there is created equal, other than there has been some concern of certain labs, kind of sharing patients' information with third parties. So that's also that sharing that kind of information out there. So that there is specific testing for like knowing what kind of genes you may have, genetic variants that put your risk. That is one part, which would be what we've been talking earlier with the medical genomics. When we mention MTHFR, ApoE4 genes, there's the coffee SNP that is actually related how I feel when I drink coffee or not. Like there's tons and tons, like thousands. But when it comes to actually epigenetics, there are other tasks. Like there's one big one that I know of, which usually is using the famously known Horvath clock, which was actually designed in 2013, a few years back, which is actually measuring the epigenetics age also, which means not only we can kind of predict with this type of testing what would be your, let's say, your biological age based on your chronological. Are you actually much more older? Are you aging faster? So all of these, and it's kind of like a field that always also keeps growing. There are different tests that are out there just to measure this. And actually taking more certain metabolic markers, especially within the blood, that can actually makes you, make perhaps more aging, either more oxidative stress effect, more inflammation. All of these, we know that ages people. Also, it kind of helped us even know most of the studies and research around different tissues, which tissue has aged more faster than others and within the human. So it's actually been a very useful test. Some of my patients have asked for this in terms of, I really want to know, can I actually stop the clock, or let's say age gracefully, or what else can I do? So this has actually been also useful alongside the medical genomics. So I can't say that one favors the other, because I think I definitely want to start with the medical genomics portion in terms of what I know to see what are the risks. And I work with my patients fairly well with using the medical genomics, but that sometimes I have certain patients that they want to take that extra step and kind of to see like, okay, how old I'm truly am. Are you a 40-year-old that their biological, it looks like they're in their 20s, or you're actually in your 50s, and we definitely need to work on a lot of things to help you there.
Yes, yes. And I think that that's, important to know, because at least what I find is that a lot of more patients, because of, again, mainstream, what is out there, they might be searching more for the biological age versus the actual age that I am, and like the longevity component of it, right? Where I think that it is important, but again, I think that starting at what our body's doing, again, at that similar level of like the little machines, and how we can make that machine work better in a way will have a positive impact in our epigenetics. And especially if we implement a lot of the things. So I think that one by itself will have a positive impact epigenetically, right? That sometimes, when patients are a little bit kind of like, what should I do? It might also be something good to let them know, right? Um,
Right, right.
yeah. So a couple of like questions also that patients ask. And I think that it's important that we speak about them independently of what patients might or might not decide to do. So one is if these tests are covered by the insurance or not. And then the other thing that sometimes people are afraid of is, so if I do this test and there is, knowledge, for example, through their insurance that they have these tests and they tested positive for or a risk of certain cancers, could this affect things like life insurance or them getting into jobs? And I'm going to use the word like perhaps discrimination, right, against them because of their genetics. So, can you speak a little bit more about how you can help patients navigate perhaps those concerns?
Yeah, so that's why usually it is very important what type, let's say, genetic testing you're going to use, and trust in them, especially that they would keep their information private. That's why I'm saying that there has been certain ones that unfortunately they have been shown to actually share information, which is not good. And there's pretty much, a law against that. But with the medical genomics, when I perform it with my patients, I try to, the one that I particularly am using, they do have a much more private access to get to their report. So I'm not actually putting that information in their chart. Now, it depends on the case. Obviously, if it's a young person, or let's say I'm doing yours medical genomics, Maria, I wouldn't actually put it in your chart. in case you're, dealing, because you're still at the age that, maybe dealing still with health insurance and life insurance, is because you don't want them to catch on things like, oh, they do have the gene that makes them at risk for Alzheimer. And then they can actually want to say like, oh, we're not going to cover you for that if it happens, or anything related to that, which is that the way that I put it in the patient's chart, I do give them like a full detailed summary from the report that is kind of sent separately, not within the actual EMR portal. And then I would actually mention in their notes that, oh, we discussed that patient has, for example, the family history with cognitive decline or Alzheimer's disease within their family. We discuss about certain things that they can incorporate, especially with considering patient will be visiting with the dietitian to go over options for more like keto flex diet. Patient's going to start with some turmeric to help out for potentially for inflammation. So I kind of word it in a way that I'm not targeting or putting a specific label on the patient. And that's just to kind of help protect my patient information. Now, for majority of cases, when I'm seeing some patients that are, for example, already like in the Medicare range, 65 plus, for example, that is not concerning or that big of an issue of addressing or putting that information there.
Yeah, and I think that that's actually a really good idea. And I love it. This kind of like, I'm going to provide you a summary versus like share the complete, report. That, I mean, there's a lot of things that happen with technology, right? And the web and all that kind of stuff. So being a little bit on the safer side. And I think that that also can help for those patients that this is like a concern. It can help them also reduce that worried or that fear. So I love that. Yeah.
Yeah.
So I think that then my last, probably, towards like the end, my last question is, so let's say that, a patient or somebody is hearing this and they're like, I wonder if this is something that I should do and how can I do it? What would you recommend to them? And what I mean by that is, again, I know that there are some companies online that people can request certain testings. Yet I feel that sometimes when that's done and they don't have then like the proper, not only advice of the test, but then like a plan and
Right.
and somebody that is going to look, okay, is the plan working? Or is it, what we're doing, is it working or not? And then I'm not sure that that's completely beneficial to like patients. So what would you tell somebody, if they're like listening to this and they're like, maybe this is something that I should do and it's an option, what would be good ways to navigate it?
Yes, I mean that's an excellent question because that we have access to these kind of tests. I have found them to be, I mean, some of them are very, let's say, not very detailed, and I guess it's a good kind of like a starting point. Or if somebody wants to have fun, like I did many years ago with one of them, and I got a report, but it was a bit difficult. I know what to do being, integrative, functionally trained, but I can see some of my patients, perhaps if they do that, how do I take this to make it as an actionable plan? And that's why usually I recommend more a clinician tool for using for medical genomics, like the one that I've currently used for our patients, which usually they do offer training across the US, and they're even going internationally for training even physicians on this tool. I would probably recommend for people to consider seeing a physician that is actually trained, and because you want to give the information to the patient, do a first action plan, and you want to see progress. You want to see how they're doing with the original recommendations. And oftentimes also because this type of test is so robust and extensive, it is sometimes a bit overwhelming when you give all the information at once. So you want to kind of keep working for couple of months, even up to a year, which some of my patients work with me to pretty much kind of like untangling all the findings. Now, there are people that have, let's say, excellent medical genomics, they're relatively healthy. It's kind of easier. But when we're trying to help somebody that has been struggling with many, many years with a complaint, either they're struggling with things like, just to give an example, because I see this in my clinic often, like people with chronic Lyme, or they have some sort of autoimmune condition, it takes some time. And you want to actually kind of revisit and keep using their medical genomics other than as well as their labs and how their response is to see if we're making progress. Because actually for people to make lifestyle changes, it is not easy. You have had some patients that they have had pretty much very poor diet or nutrition. They're not going to change overnight. That's the reality. You have to kind of work with them, and you show them the data. Like, see, you have, let's say, one of the ones, the SNPs that are STAT3 genes. These have been linked with your body's ability to metabolize or process, let's say, saturated fat. So for that kind of patients, I'm going to focus on a more lower saturated fats, also to help them with their weight loss goals. So this is the kind of thing that we often do within our practice. And I know other physicians that are trained also with this type of tool around here in the US.
Yes. And I think that one of the things that you mentioned that I think that is important. And that's why I say your body's not a microwave. And not necessarily all places, but I do find that, again, because how society has changed in culture, a lot of the times patients are expecting that we're going to find the answer to X problem, that is going to be a Y simple solution, and that as soon as they do it, they're supposed to like feel better. And I think that one of the things that you mentioned that is important is that some of these things are going to, it might take longer. One, because I feel that for people, especially if it's a lot of changes, concerning to like their lifestyle, that by itself takes time to like implement and sustain, right?
Yeah.
And then also I feel that our bodies take a little bit also of time to like respond in terms of like how you feel, or for you to see more objective changes that are quantifiable as well. So I think that that's something important that I want to mention again, because for me and my practice, I always try to help my patients understand that some things are faster and easier and our body responds quickly. Some other things just take a little bit more of time. And I think that um, there are some things that it's not only can we afford the testing, but it's also, do I have the time, the motivation, and that maybe resiliency to then, like implement it and say, well, maybe I'm going, yeah, I started it this week and my body's not responding. So I'm not going to give up. I'm going to continue to do X and Y, 2, 3, 4, 5 weeks, whatever it is. And again, that you said it's a lot of information to digest. So sometimes going slower is better than faster in some areas. So I just wanted to like emphasize that for people and for anybody that is listening to us. So that being said, as we're coming to the conclusion, is there any other final words of wisdom when it comes to personalized medicine and looking at our genes and how our body works at this like level that we cannot even see, that you want to share with people?
Yeah, I mean, right now we have, science keeps advancing. So it's actually great that we have developed these kind of tools. Again, it's best when it's handled by a, physician that is trained and it's knowledgeable, because obviously I've had some cases where patients have taken, let's say, the report to another doctor and they're like, I don't know what to do with this, or, you know, I don't understand it. So I have to kind of have them, make emphasis that, especially when you work with somebody that knows about this concept, but obviously working with a doctor that can spend enough time as you learn in the corporate healthcare world, or let's say the insurance model, we know that oftentimes doesn't work great for patients. It might be great when you want to get like things done for like a upper respiratory infection, or somebody that needs to go through like a gallbladder removal, cholecystitis, things like that. But when it comes to like untangling chronic issues, things that's been going on for years, it is hard to do it in a 15-minute visit. You need to work with somebody that has ways to pretty much spend more time with you, listen to the whole story, be kind of like that medical detective. And that's how I like to interpret and use also the medical genomics. Is kind of like another tool in my toolbox as me being a medical detective to help out on my patients the most. And it's been great value for us.
Yes, yes. So one of the things that I also want to ask is, so if somebody is listening to this chat and they're like, oh, I want to work with Dr. Gabriela. They want to know a little bit more about what you do and just see if, explore if you guys are a good fit. How can they do that and how can they get a hold of you?
Sure. I think the easiest way people can point out, our website, which is resilienthealthaustin.com. We've been going through some changes. There's been a lot of growth within our Resilient family. We have a new physician, and also looking and having another physician in the near future, hopefully. So we've been pretty much doing the full spectrum primary, integrated, and functional medicine right here in Austin for about almost 10 years or so. Our founder, Dr. Hausman Cohen, pretty much started this with the practice with the whole concept of, being able to spend enough time for their patients, getting them better, but also integrating certain tools, which one of them being the medical genomics, our clinic being the flagship for one of the medical genomics tool. That is the one that we've been mostly using, which is called Intellex DNA, which people can also feel free to visit their website, intellexdna.com. I don't know if you can probably add those to at the
Yeah.
bottom just in
Yeah.
case, but that would be very useful because they do have the publications and research papers that's been done, especially related to the Dr. Dale Bredesen, related to the RECODE program, the reversal of cognitive decline. There's also a lot of certain podcasts that Dr. Hausman Cohen has made, which is very informative, and people can get to know a little bit more about the use of medical genomics, and they might find that very helpful.
Okay. Awesome. Thank you. Then I remember what I was actually going to say when I was like, oh my God, my mind just went. And this is something that, I just want to share with people that have also like worked with me and that know me. And it's when I did the same fellowship that Dr. Gabriela did with the Academy of Integrative Health and Medicine, that we learned a lot. There were two kind of like things or modalities that I truly fell in love with and that I have been slowly incorporating into my practice. Because again, you need a little bit more of that training. And one of them is the acupuncture, which again, I have already incorporated and done extensive training in that. But then the other one was especially with combining it with food, right? So the genomics, nutrigenomics, because I just love food and I'm like a foodie person. And so I really just want to say this because I feel that in the traditional Western medicine, as Dr. Gabriela mentioned, yes, if you have a cold, strep, UTI, you've had an accident, you need surgery, it's really good. I'm not saying like don't do those things, right? And I'm not saying like that is like bad medicine. But what I'm saying is there's a lot of other tools that are not utilized in conventional medicine that can be very healing, very powerful, and sometimes even have less side effects or risk for you as a patient. So really look into this, because this was one of the other things that I was like, oh, wow, this is like a passion.
Right.
Yeah.
And that's when I actually learned it when I was doing the fellowship, one of our workshop that we needed to do, that's one of the talks. It was a huge topic. And I pretty much was kind of drawn into that, which I started myself, doing it on myself, using as my own patient, like my own guinea pig. And I noticed that I had certain SNPs that were related to my body not absorbing well magnesium. And when I made that switch, I've been always suffering with migraines. I noticed a shift on my migraines, other than I did have the double for homozygous for MTHFR. Once I addressed that with more methylated folate, with the magnesium, all that has helped tremendously in terms of not only with my lessening the migraines attack, but also with my mood, with my sleep. So it participates in so many enzymatic pathways in our body. So we do need these cofactors. So it is important, yes, addressing the diet, but do we need to supplement? That is also important.
Yes, yes. And that's why I say, like sometimes there can be this like, oh, everybody should be following this diet, but not even that guarantees that you as the person might completely feel better or have all the, benefits or whatever it is that you want to like say. So again, for those patients that sometimes might be a little bit more reserved because of the cost of some of this testing, I just want to say this is less risky than even some medications that are out there to like treat migraines, as Dr. Gabriela said.
Right.
So, yeah, yeah. So, with that being said, I want to thank you for being here, for taking your time to chat with me. I will be putting the links in the show notes for everything that we talked about, so that you can either connect with Dr. Gabriela or go to the website and then look a little bit more about what this is and if it's something that you want to explore a little bit more. Until next time.
Thank you so much for having me, Dr. Maria.
Yes, thank you.
Take care. Bye-bye.